my birthday in place. And so that's where I began. San Benito, Texas, right at the end of World War I, September 1918. And I lived in the valley not even a year before my family moved. My father being a civil engineer, who had come here in 1906 and built the Mercedes in San Benito, the adjacent projects. We moved. And so I grew up in Wichita Falls in Austin, Texas, primarily. Went to the University of Texas, information school in Galveston, and did internship and subsequently pediatric board training in Denver. In the middle of that time, I spent a couple of years in the South Pacific. World War II as a tight in surgery, and was either fortunate or unfortunate enough to bring back from there a goodly supply of amoeba and a balloon liver of hepatitis from them, and various assorted intestinal parasites, fairly good menagerie, and a Purple Heart and a Blind Star and a humpback medical mill, and enough to realize I had been out of medicine long enough that I didn't know enough to go into general practice in some of the places I thought of, which included Corpus Christi and Sherbrooke and Austin, where I would mostly go out. So I went back to Denver again, to Denver Children's Hospital, and did specialty training pediatrics. During my time there, I was on one of the 4 national polio emergency teams, and I was finishing and ready to go to Austin, where I had an office rented already, when the Polio Foundation people approached me about one more epidemic. I said, I can't do that. I'm making $50 a month to the women board and laundry, and we have one baby and another one due, and I just need to get to work, have an office in Austin. I said, I can't do it. They said, you got to. These are mostly little children, the majority of preschool, very unusual polio epidemic, and in age level. So I said, I can't do it, but where is it located? And they said, well, it's in Texas. I said, that's different then. I go, where in Texas? And they said, Edinburgh. And I said, oh, that must be in the Panhandle. Yeah, I'll do it. I don't like the Panhandle, but I'll go. So I end up in the valley and spent several months in Edinburgh.
What year was that, John?
It's actually it was in May of 1948. I stayed there several months, and things quieted a little. I went back to Denver and finished some time I had child research counselor, where I was obligated for, and then had decided by then that the valley was the place to go instead of Austin. There were no pediatricians south of Corpus Christi, and there was lots of pathology, as I'd found in the polio epidemic, where many problems were sent in that weren't polio.
John, how many beds do you recall were in that old Valley Baptist hospital?
Well, I really felt it was 2-story. I had a large basement that later, had a lot of pipes in the ceiling. It later we made it into polio wards and moved the polio. I was in charge of the polio treatment center for several years. We later moved from Edinburgh, where I came to Harlingen, and it went into that basement. In fact, my wife spent 2 months in there with the encephalitis. We had an epidemic with St. Louis treatment centers to the New Valley Baptist Hospital on Ed Cherry Drive. We built an office right near it on Ed Cherry Drive. Before the street was even paved, we built children's clinic. And it must have been, like you say, 1956 to 57. And the Sam sisters of Brownsville, Miss Lightman and Miss Porter, were very helpful. They dedicated an entire wing of the hospital, which would be more than a third of the hospital, or financed their donations. And they furnished probably the best polio treatment center in the country. At that moment, had large area for physical therapy and various types of pillows and tubs, and a whole battery of respirators, iron lungs, and it functioned year-round because we virtually had endemic polio at that time. One of the really valuable things that our local medical community had done over the years, especially my viewpoint, because it dealt with young people primarily, was that our county medical society sponsored different immunization drives. We had one, a measles vaccine came out called Operation Needle, and the doctors of the county volunteered time to help with the public health nurses. And we did that also when the Salk vaccine came out. The biggest for polio, but the biggest of all these drives, I had the opportunity to be chairman of each of them, and I would keep them in a perspective. That's the biggest and most successful of them all was the oral polio, the Sabin polio vaccine. I would call that Operation DOPE to ULP. And we really had that organized. We had a center, headquarters, operations center, located at Valley Baptist Hospital in the nursing building, and ham operators of the Valley volunteered their time. We had set up a radio network across the Valley. We teamed up with the Hidalgo Star County Medical Society, as well as Cameron Willison. And Dr. Brandes and McFallon was chairman of theirs, and I was chairman of ours. We worked together and had the Sport County Valley area interlaced with locations receiving oral polio vaccine. We had teams that were mobile in Jeeps and four-wheel drives. We had teams like the one I think of it, and my wife was the nurse on it. We had a doctor and a nurse, and sometimes a third person to keep records. But we always had a third person. We were Dr. Hartman, a radiologist, was a doctor, and my wife was a nurse, and one other volunteer.
And what year was this, John?
They covered the military highway area, and we virtually got people out and our children in their homes, or go to these nurses and doctors to go to the homes. This was in the summer of 1962, and it was a very gratifying thing. It had a tremendous response from the public and a lot of cooperation from the public, JCs and service clubs and schools, and everybody and every community helped. And it was the most saturated part of the United States, probably, on polio vaccine. And it made a tremendous difference in subsequent years